Hello everybody, my name is Deja Bell and my topic is on asthma. Today I'm going to be sharing with you guys some facts about the symptoms, causes, consequences, and the history behind asthma. With further ado, let's get started. What is asthma? Asthma is a respiratory condition marked by spasms in the bronchi of the lungs, causing difficulty in breathing. It usually results from an allergic reaction or other forms of hypersensitivity. The consequences of having asthma is difficult breathing, and you need an inhaler at all times or other medications, degree of anxiety, stomach trouble, lung scarring. You have shortness of breath, chest tightness, wheezing, coughing. The causes and triggers are smoking, air pollutants, respiratory infections, physical activities, certain drugs and food, irritants in the air, cold, flu, or other illness, stress, weather conditions, exercise, and all the above. Having asthma can stop you from doing a lot of physical activities, and as young children, that's in their habitat to do different types of activities. The main cause of asthma comes from smoking. You should not smoke. Smoking is the main trigger for asthma. Secondhand smoke is even worse. This causes breathing attack, harm to the lungs. Also, when you smoke cigarettes, it's an exposure to various irritants and substances that triggers the allergies. Also, when a person inhales tobacco smoke, its irritating substances settle in the moist lining of the airways. These substances can cause an attack in a person who has asthma. Smoke also causes the lungs to make more mucus than normal. As a result, even more mucus can build up in the airways, triggering an attack. A treatment for asthma: you can see the doctor, get proper medication, create an asthma plan, which you will go over that with your doctor. Also, you need to limit your physical activities, self-care, supportive care. Asthma can usually be managed with rescue inhalers and treatment symptoms. This is albuterol. There's multiple different types of pills, inhalers, and everything to cure the asthma, but albuterol and controller inhalers that prevent symptoms such as steroids. Severe cases may require longer acting inhalers that keep the airways open, as well as oral steroids. This is a little bit statistics of those who have asthma. In America, it's an estimated of 20, see that number? Americans suffer from asthma, or 1 in 15 Americans, with 50% being allergic asthmatic. More than 4,000 deaths each year. More females die of asthma than males. Women account for nearly 65% asthma deaths overall. And this is where it shows you the worst cities that has the asthma. This is a little baby. He looks like he's about 9 months. And this is harmful to the babies because their bodies are so small and it's hard for them to breathe on their own when they're already this tiny. So for them to have extra complications with their breathing problem, it causes them to be in a position that is hard for them as little guys. Childhood asthma occurs more frequently in boys than in girls. It's unknown why this occurs. Although some experts find a young male airway size is smaller when compared to the female airways, which may contribute to increased risk of wheezing after a cold or other viral infections. Around age 20, the ratio of asthma between men and women is the same. At age 40, females than males have adult asthma. Asthma is among the most common chronic childhood illness, accounting for 10.5 million missed days of school a year. It also accounts for 14.2 million lost of work days for adults. Each year, about 14 million Americans see a doctor for asthma. About 1.4 million patients visit a hospital department for asthma. Almost 1.75 million go to a hospital emergency room. The number of people in the U.S. diagnosed with asthma is increasing. The greatest rise in asthma rate is among Black children, with almost 50% increases from 2001 through 2009. Researchers estimate asthma-related costs, and including the direct cost of health care and indirect costs such as decreased worker productivity at around $60 billion annually. Many people with asthma manage to condition well and can live a healthy and productive life by avoiding triggers and following their allergist instructions. If left unmanaged or undiagnosed, asthma can be fatal. About 3,000 people die a year from this annually. Thank you for sitting here and listening to my presentation, and I hope you guys learned something about asthma. Have a good day. Bye-bye.